guys, this is Dr. Hub. Today we'll look at the fertility indicators. So what are the fertility indicators include? The first comes the crude birth rate. So it is the simplest measure of fertility, although its usage is unsatisfactory. So it is a simple method and its usage is unsatisfactory. Then in India, as per the SRS Bulletin 2018, it has a birth rate of 20 per 1000. It has a percentage of 20 per 1000 population. This is SRS 2018. So let's write it in formulae. That is, the crude birth rate CBR is equal to the number of live births during the year. So it is number of live births which occurs in a year, and it is divided by the estimated mid-year population, and you multiply it by 1000. Next comes the general fertilization rate. General fertility rate is a better indicator of fertility than the crude birth rate. So it is greater than the crude birth rate. And the demerit of the indicator is that there is not all women in the denominator are exposed to childbirth. So not all women in the denominator are exposed to the childbirth. So what do the GFR include? The GFR, it is equal to the number of live births in an area in a year. The number of live births, this is in area. In area of in a year. And what do you divide it with? You divide it with the mid-year population of women in the reproductive age group. So mid-year population of the women, and this will be in a reproductive age group, reproductive age, and in the same area in the same year, in same area and year. And most importantly, you multiply it by 1000. Next is the age specific fertility rate. So this is more precise measure of fertility. This is more precise measure of the fertility, and it is also a sensitive indicator of the family planning achievement. It is a sensitive indicator. And this is of the family planning achievement. So what does this ASFR include? So ASFR is equal to the number of live births in a particular age group. So it is a number of live births, and it occurs in a particular age group. And you divide it with the mid-year female population of the same age group. So there is a mid-year female population of the same age group. So this you multiply it by 1000. Next is the total fertility rate. The total fertility rate, it is a sum of all specific fertility rates multiplied by 5. So it is sum of all the age specific fertility rates. The sum of all age fertility rates multiplied by 5. So we multiply it by 5, and this measure gives the approximate magnitude of complete family size. So it gives the approx magnitude of the complete family size. Now let's look at what is TFR. So the TFR, it is the total fertility rate, and it includes the sum of all age specific fertility rates multiplied by 5 and gives the approximate magnitude of complete family size. So the formula is the number of live births a female will bear during a reproductive age. Number of live births during the reproductive age. This is assuming the ASFR. Assuming the ASFR. And this has to be divided by the median population of women in reproductive age group in the same area in the same year. So mid-year population, and this is going to be of women of the reproductive age group and in the same area as well as the population. So this you multiply it by 1000. Next we move on to the GRR. So GRR is nothing but the gross reproductive rate. So gross reproductive rate is the average number of the girls that should be born to a woman if she experiences a current fertility pattern throughout her reproductive span. So the average number of girls that would be born to a woman if she experiences the current fertility pattern throughout her reproductive span. So current reproductive pattern throughout her life, her reproductive span, assuming no mortality, and you assume there is no mortality. So let's get to the writing the formula. So it includes the number of daughters. So it is nothing but the number of daughters, and this is of a woman, number of daughters a woman will bear during her reproductive years. So this is during her reproductive years, the number of daughters she will bear, and this will be assuming the ASFR. So assume the ASFR, and you divide it with the median population of a woman in the reproductive age group, and this will be with the same area and the same year, and you multiply this by 1000. Lastly, we are going to look at the net reproductive rate. So this is a demographic indicator. And the NRR of 1 is equivalent to approximately 2 child norms. The NRR is 1. NRR is 1. It is equivalent to approximately. 2 child norms. 2 child norm if the NRR is less than 1. Then the reproductive performance of the population is said to be inadequate. So the reproductive performance of the population will be inadequate. So what is the formula for the NRR? So NRR is equal to the total number of daughters. So it is the total number of daughters that a newborn girl child will bear. So that a newborn girl child will bear, and this is during her entire life. This is entire life. This is assuming the age specific fertility and mortality rates. So age specific, you assume the age specific fertility as well as the mortality rate, and you divide it with the median population, and this is of the women in the reproductive age, group, and in the same area in same year, as well as same year. And what do? You multiply this by 1000. You multiply it by 1000.